This video from the Innovation Leaders Club will explain why developing empathy is a key skill in innovation through an example from a GE Healthcare case study. Listening to your customers is often repeated by innovation professionals as a critical approach to gaining insights. However, sometimes the voice of customers is not enough. Developing empathy is really what matters, so that you can understand the feelings of the user who is not necessarily the customer. This case study on GE Healthcare is a great example. We have developed a 60-page visual guidebook on how to develop an innovation strategy. It is a fully illustrated step-by-step guide to building the foundation of an innovation system. Click the link in the description below to download it for free. Instead of falling in love with your design, fall in love with your customers' problems. Doug Dietz, an industrial designer for GE Healthcare, an $18 billion division of one of the largest companies worldwide, was assigned to develop the program of magnetic resonance imaging, or MRI, systems. You can learn more about this human-centered design breakthrough with this video. This is a good example of excellent innovation. We've also summarized some of the key messages for you. Doug Dietz visited a hospital to witness and discuss an MRI installation. He chose to talk with the technician about the machine's performance. Because the technician's feedback was completely positive, Doug went on to congratulate himself for a job well done. The technician informed him that a patient needed a scan, and Doug went with him. The patient, a young girl, was anxious and fearful about her scan. To his surprise, the technician called for an anesthesiologist. But why? If there was nothing wrong with the MRI, why would the young patient need to be anesthetized? The technician informed Doug that 70% of pediatric patients needed sedatives for their scans. It was so bad that some appointments even needed to be rescheduled, forcing them to repeat the MRI setup all over again. Doug crouched down to look at the scan room from a child's perspective. He realized it looked like a slaughterhouse, cold and uninviting, with a menacing yellow arrow on the floor. He put himself in a child's shoes, the most vulnerable patient. He was able to witness the anxiety and outright fear that many children experienced when using this machine, and it triggered a crisis for him. It pushed him to find a way to make the machine more comfortable and inviting for future children. Doug went back to GE's management and tried to justify a project to make the MRI less scary. It was not accepted due to a lack of financial justification. He still wanted to change how the kids perceived the MRI. He wanted to solve the problem of children needing sedatives every time they used this machine. So in his spare time, he got various health professionals together to help him brainstorm low-cost foam prototypes for potential solutions. The solution had nothing to do with MRI technologies, but rather how the machine was presented. With collaborators, Doug was able to come up with a whole suite of graphics to dress the MRI, costumes for the medical staff, and a story to be read for the child during his or her scan. By doing this, he was preparing the children for an adventure. One of the MRI designs he came up with was a pirate ship, and it had a story to match. The parents would read to their child about taking their pirate ship to find a treasure island. In the story, the boat would be attacked by pirates, so the child shouldn't move, and if they did, the pirates might find them. If they stayed perfectly still, they'd be safe in the boat. Afterward, they'd find the treasure and get a surprise. Doug was able to turn something scary into a creative adventure. What should you remember from this case study, and how can you put it into practice? If you haven't already done so, you can get your hands on our popular 60-page visual guidebook for free. Click the link in the description below. Don't hesitate to watch the next video to learn even more about innovation management practices.